Okay, so I found this. Well, so who is here? Well, today we are going to speak about explaining and reassuring. This is the second part, the second class on Unit 4, as you see, and we are starting with the first slide here of the presentation. Well, now, So, as we usually do, first we discuss what we've done previously, the home assignment. You were given the task to deal with sentences, to complete the sentences, either with the present simple, active, or passive voice. And so I would like to discuss some sentences here. There are not all of them, but some of them which were the most problematic in this task. So you see that the task was, as you remember, to complete the sentences with the verb form, which is better. So the active voice or passive voice. So who is Priya is coming? Well, okay. Now the first sentence, let us look at the first sentence. Arunchalam, please. What do you think is better to use?
Yes, the park gates dash at 6:30 p.m. every evening. The park gates lock at 6:30 p.m. every evening.
Well, when we use the active voice, it means that the subject, which is park gates, does the action itself. But for example, if I say somebody, the person, so yes, I can say locked. The person locked the park gates, but the park gates can do it themselves. That is why it's better to use the passive voice. Will you use the passive voice here?
And passive voice here, the park gates locked at 6:30 p.m. every evening.
The passive voice consists of two parts, the verb to be and the ed form of the main verb. So where's the verb to be? The park gates? Who can help us?
The park gates are locked at 6:30.
Are locked, yes. Yes, we can say are locked or were locked. It's better to use present. Are locked is better, okay? So, Madhumita, please, the second sentence.
Yes, ma'am. Why did Sue resign from her job? Didn't she enjoy it?
So, I didn't get it. So, which
Why
form?
did... Ma'am?
Yes, will you repeat, please?
Why did Sue resign from her job?
You're
Didn't
right.
she enjoy it?
Why did Sue resign? So, this is active voice because Sue did it herself. Okay, so Divya, please, the next sentence. Divya, are you here? No, Divya. So this is minus. Priya. Priya is only coming. Rajkumar. No, we don't have such students and Badris.
Ma'am, Priya is waiting, it seems, ma'am.
So Priya, are you here? Okay, so he's just coming. Prerna. Prerna, please.
Yes, ma'am.
The next sentence.
Why dash from his job? Did he do something wrong? Why was Ben fired from his job? Did he do something wrong?
Exactly. So
Was
here
Ben fired?
the passive voice. Okay, the next is for Nishat.
Yes, ma'am. Where dash these pictures take in London, dash you take them or somebody else. It should be where were this picture taken in London? Did you take them or somebody else?
Yes, in this case, we have both passive voice and active voice.
Yes.
Did these pictures, no, were these pictures taken and did you take them? Mhm.
Mm.
Okay, good. Now please, Prakriti.
Ma'am, the boat hits the rock and dash sink quickly. Fortunately, everybody. Ma'am, the boat hit a rock and the sank quickly. Fortunately, everybody was rescued.
Was rescued. Yes, exactly. You are right. Mhm. In the first case, we have sank active
Yes, ma'am.
voice and were rescued passive voice. Okay, Samhita, please.
Yes, ma'am. This is while I was on my holiday, my camera while I was on a holiday, my camera was stolen from my from my hotel room.
Exactly.
Was stolen.
Was stolen. This is passive voice. Great. Now, Rafa, please. Rafa? No, Rafa?
Yes, ma'am. Ma'am,
You're here?
the letter was sent a week ago and it arrived yesterday.
Exactly. So in the first gap, we have was sent, the passive voice, and it arrived, the active voice. So you just, that were the sentences where you had some typical mistakes. There were some several mistakes, especially in the first sentence. So be very careful with the use of the active voice and the passive voice. Now we are going to speak about the doctor that we started listening at the previous class, you remember? Do you remember his name? Who remembers his name? No one. Mhm. His name is Dr. Quinn. And now we are going to speak about reassuring. Reassure means to say or do something to remove the fears of patient here. So we were listening to the conversation and the doctor described the endoscopy to the patient. And he used two adjectives to help make the procedure less frightening and thus reassure the patient. And here is the example of sentences that were used by Dr. Quinn. So the tube will have a tiny camera, tiny, he says, and it's a routine procedure. So, and I mean that he uses these adjectives just to help the patient to relax. And now let us try to make sentences more, not make, but decide which sentences are not very reassuring. So here there are 8 sentences. Let us read them and decide which are reassuring, which are not very reassuring. So Ayman, please read the first sentence.
Yes, ma'am. Ma'am, the first sentence is, it's a very simple procedure. So I think it's reassuring, ma'am.
Yes, he uses very simple, the adjectives that help.
Adjective.
Okay, reassuring. So let's listen to Arun Chalam now. Second
Yes,
sentence.
ma'am. We are just going to take some fluid from your backbone. It's also reassuring, only, ma'am.
Reassuring. So he uses just and we are
Just.
clear. Yes.
Some fluid.
And so there is a picture illustrating backbone here. So what's another name for backbone? Another word?
Vertebral column.
Vertebrae, ma'am, vertebrae.
Vertebrae. Okay. So the next is for Madhumita.
Yes, ma'am.
Mhm.
You'll feel slightly sore after the test. It's reassuring, ma'am.
Exactly. There is just and slightly. Mhm.
Yes, ma'am.
Well, the next is for Divya. Has she come?
Yes, ma'am.
Mhm.
All you will feel is a tiny scratch, nothing more. Tiny, ma'am.
Tiny, yes. That is why this sentence is reassuring. Mhm. Well, now, Priya, are you here?
Yes, ma'am. It
Mhm.
will take 10 minutes. Ma'am, it's not reassuring.
Okay, yes, because there are no adjectives, there are no polite phrases. How can we make it this sentence more reassuring?
Ma'am, it will take just 10 minutes or
Mhm. Yes, yes, you're right. Yeah.
few minutes only. Just few
Mhm.
minutes only.
You're right. Okay, good. So that was who? Priya, yes. The next is for Prerna. Prerna.
Yes, ma'am.
Mhm.
Fifth sentence, ma'am.
Number 6.
Okay. It only takes a few minutes. It is a reassuring sentence, ma'am.
Yes, a few.
It reassures that it will take only few minutes, so it is fine. It will be
Yes.
fine with.
Yes, you're right. He uses a few and only. Mhm.
Yes,
And
ma'am.
Nishat.
Yes, ma'am. It is not a pleasant procedure. Pleasant, ma'am, it is not a reassuring. Reassuring and not a pleasant procedure.
How can you make this sentence sound more reassuring?
Like it is a pleasant procedure, ma'am.
Yes,
By
but
removing.
you say that this sentence is not reassuring, so it doesn't help
Yes.
the patient to relax. How can you improve the sentence in such a way that it sounds more reassuring? What can you add to the sentence? Hmm?
It is a pleasant. It will be a pleasant procedure.
Really?
No, we have to remove pleasant here.
Yes, and what do we have then without
What can
pleasant?
we say?
Simple
Ma'am, can we
procedure.
say it's not
Easy
a
procedure.
Yes, it's just a simple
Easy procedure.
procedure.
Mm.
It's just a very simple procedure.
Yes, a common procedure. Okay.
Yes. Yes.
Okay, the next is who? Prakriti.
Yes, ma'am. You will hardly feel anything. Ma'am, it is a reassuring.
Reassuring sentence, yes. Hardly is used for this purpose. Okay, so keep in mind how to make sentences sound more reassuring to a patient. And if we move, can we move to the next slide? Yes.
Listening 3.
Just a minute. Well, now we're going to listen to some statements, 8 statements. And you should write the word the doctor emphasizes, the doctor stresses in each sentence. And then we'll answer the question about why he does this. You see, please prepare something to write on paper. And let us decide which word the doctor stresses in each of the sentences. And you'll tell me if you're here or not. So now,
Listening 3. 1.
yes, ma'am.
yes, do you hear?
Yes, ma'am.
Okay,
Yes, ma'am.
Yes, ma'am.
see, good. Now,
Listening 3. 1. It's a very simple procedure. 2. We're just going to take some fluid from your backbone. 3. You'll just feel slightly sore after the test. 4. All you'll feel is a tiny scratch, nothing more. 5. It'll take 10 minutes. 6. It only takes a few minutes.
7. It's not a pleasant procedure.
8. You'll hardly feel anything.
Okay, so 8 sentences. So in the first sentence, which word is stressed?
Very simple.
Simple, simple.
Yes,
Very
simple. In
simple.
number 2, in sentence number 2.
Just.
just.
Just, okay. In sentence 3.
Slightly.
Just and
Slightly.
Slightly, yes, slightly stressed. In sentence number 4.
Feel.
Tiny.
Tiny
Tiny.
scratch.
Yes, a tiny
Tiny.
scratch, yeah. In sentence number 5.
10 minutes.
10.
10 minutes.
10 minutes.
So the doctor emphasizes that it will be short. Okay, number 6.
Yes. Few
Only.
minutes.
Only and few, ma'am.
Only and
Few
few.
minutes.
Okay, number 7.
Not a pleasant.
Not a
Pleasant.
not a
Pleasant.
Unpleasant.
And in the last sentence, number 8.
hardly feel.
Hardly.
Hardly.
Anything. Ma'am, anything.
Anything and
Yes,
hardly.
Hardly.
like hardly
Anything.
and anything, yes.
Anything.
Okay.
Hardly anything.
Yes, ma'am.
So the question, why does the doctor emphasize these words?
Ma'am,
Why?
to
Because these are reassuring words, ma'am.
reassuring words.
Reassuring to the
So
patient.
patient won't feel
Yes.
feared or scared.
Yes. Okay. He emphasizes the words that show that the procedure won't be very long and very painful. Yes. Okay. And
Listening 3.
if we move to the next slide, here there is information about some grammar information. And so the doctor explains procedures with the use of to be going to for future. So doctors need to explain procedures before they perform them so that they can obtain patient consent, you remember? So the future with the be going to is usually used to explain a procedure, even when the patient hasn't yet agreed to the procedure or given consent. The be going to future is used because it is the clearest and most direct way to give an explanation. So it means that the doctor fully explains and the patient can give informed consent. The example here is we are going to give you a mild sedative. So the doctor says, we are going, even when the patient hasn't agreed to the procedure, just to be confident that this will happen. Well, and some examples. In addition to using to be going to future, doctors often use fixed expressions with what to explain procedures. So examples of the using be going to and what. So it's not a question. This is the some extra word that helps to explain. The examples. What we are going to do is take a tiny sample from your scalp. So we have what and are going to. Then what happens then is we are going to give you a mild sedative. What happens next is that we insert the needle. What we need to do after that is stitch the wound. So here are the examples of the use of this structure, how we can use this structure. And now let us look at the sentences here. And we need to change the explanations to be going to future and simplify the medical terms. So we indicated to use the expression with what. So some sentences should start with what. Well, let us listen to Samhita, the first sentence is for you.
Yes, ma'am. A sample is taken from the bowel. We are going to take a sample from the bowel.
Exactly, great. So, Rafa, please.
Yes, ma'am. What we are going to do next is attach the opening on the abdomen. What we are going to do next is attach the end of intestine to the opening on the abdomen.
Okay, yes, good. Well, the next is for Ayman, please.
Yes, ma'am. It's a sample is taken from the cervix. It would be the sample will be taken from cervix.
And if we use be going to?
We are going to take sample from the cervix.
Yes, okay, good. Now, Arunchalam, please.
Yes, ma'am. After that, a tube is passed to the urethra. What happens next is a tube is passed through the urethra.
Can you use be going to?
After that, the tube is going to pass through the urethra.
It's going to be passed.
Passed through the urethra.
Okay. What is going?
What
And
happens next is the tube is passing through the urethra. Ma'am.
Can we use active voice here?
What happens next is the tube is going through.
That we are
to pass through the urethra.
Okay, the tube is that we are going to pass the tube, a tube through the urethra. Okay. Yes, the next is for Madhumita, please. Madhumita, are you here?
Yes, ma'am.
Number
What
5.
we are going to do is the glands will be removed from the axilla.
What we are going to do then is
The glands
to remove the glands
from the axilla.
the axilla. It's better to use active voice here. Well, the next is for Divya.
Yes, ma'am. What is next? A sample is going to remove from the lung.
What we are going to do next is to remove a sample from the lung. Make it active voice, you see? Okay. The next is for Priya.
Yes, ma'am. What we're going to do is a tube is advanced down past the prostate into the bladder.
Can you use active voice? Here, a tube is advanced down. The verb is used in the passive voice. Can we use the active voice here?
Yes, ma'am.
Please. What we are going to do after that is to advance a tube, right? To advance a tube down past the prostate into the bladder, okay? Well, then please let's listen to Prerna.
Yes, ma'am. A dye is then injected into the pancreatic and bile ducts to visualize them. We can say that this as what we are going to do next is we will inject a dye into the pancreatic and bile ducts to visualize them.
Good, yes, great. Now the next is for Nishat.
Yes, ma'am. The muscle is repaired with a mesh, ma'am. The muscles will be going to repair with a mesh.
Start with the we.
we will be going to do to muscle is repaired with a mesh. It doesn't show.
No. We are going to
Repair muscle with a mesh.
Yes.
Repair the muscle with a mesh.
We are going to
Yes.
repair the muscle with a mesh.
Repair a muscle with a mesh.
Okay. Well,
We'll be going to repair the muscle with a mesh.
Thank you. Now, there are some more tasks here. Sometimes you may have to give a patient a brief explanation of a procedure, and let us have a look at the sentences and explain the conditions using the expressions. A condition where, an illness where, a procedure where, a device which you use to. So it means we add some, just make the complex sentences with the help of these words, which and where. Example, anemia, and the phrase which is given here, not enough pigment in the blood. And we use the first phrase, a condition where, and explanation sounds like it's a condition where you do not have enough of a special pigment or coloring in your blood. You see? Now we are going to give explanation, a brief explanation to the following procedures, 6 just conditions of procedures. Let us listen to Samhita.
Yes, ma'am.
The first one.
Anemia. Yes,
No.
ma'am.
Number one. Number one.
Yes, ma'am. Appendix inflamed. Remove.
What is it? Is it a condition or a procedure?
Ma'am, it is a condition.
No,
It's a procedure.
It's a procedure.
It's a procedure.
So,
yes, ma'am.
Use this phrase, a procedure.
A procedure where inflamed appendix is removed.
The procedure where inflamed appendix is
removed.
Is removed. Good. Okay, Rafa, please. Number 2.
Yes, ma'am. Alzheimer's disease, someone memory loss, mood changes, cause not known. Alzheimer's disease is a condition where someone lose their memory and there are mood changes and the causes are not known. Alzheimer's disease is a condition where you lose, we can write where you lose memory and there are changes in the mood and the causes are not known.
The cause of this disease are not known. Okay, good. Well, now please, number 3.
Yes, ma'am. The next sentence is hemorrhoidectomy, piles tie cut out, ma'am. It's a process, hemorrhoidectomy, ma'am. So in which we can say that it is a process in which the we piles tie cut out. We cut out the piles ties.
You're right. Procedure where we cut out the pile. We cut out the piles tie.
Piles tie, yes.
Okay, good. Well, now please, Arunchalam. Number 4.
Diverticulitis, sac or pouch, weak points, gut infected, inflammation, pain, diarrhea, constipation. It is an illness where sac or pouch, weaks for points get points of the gut infected, inflammation, pain, diarrhea, and constipation. It's an illness.
Okay, you know better, so it's very hard for me. Well, okay, so Madhumita, the next.
Sigmoidoscopy, look at colon sample. It is a procedure where we look at colon sample.
Okay. And now, please, Divya.
Yes, ma'am. Anesthesia general put you to sleep, come round. It's a procedure, ma'am. Anesthesia is a procedure where a general put you to sleep, come round.
It's a general procedure, yes, when you are put
Yes,
to sleep. Okay. Well, now we're going to read some information about one of the procedures, which is gastroscopy. Actually, this is the leaflet that gives information about gastroscopy. Now there are only the headings taken out from the article from this leaflet. And if we look only at the headings, we should decide what information each part of the text contains. So the first heading here is Priya, please read it.
Yes. What preparation do I need to do?
So what is this part of the leaflet about? Who I, doctor or patient? Who is I here? Who do we make?
Can I?
Patient, ma'am.
Patient, yes. And
no, it's doctor.
No, this is the leaflet to a patient. That is why this is I is a patient. And so it focuses on some what the patient should do before the procedure. Yes? Okay, now we have the heading, what can I expect after the gastroscopy? So what will this part of leaflet be about? What it will be about?
Ma'am, patient.
Yes.
Patient, ma'am.
Yes, this is about patient. And what kind of expectation is it about?
What will be the after effects of gastroscopy?
Yes.
Is it about how the patient feels or about
after the gastroscopy?
Okay, okay. So then, is gastroscopy reliable? What is this part about?
Patient, ma'am. It is also patient.
And what kind of question is it? Will the patient ask?
Like if gastroscopy is good, or like
I think it can
have
cure that
effect.
problem.
Yeah,
Yes.
better or not.
Effective for the problem.
Better or not.
Cure their problem.
Yes. Is it effective
Gastroscopy
in
cure the
solving the problem? Okay. And the last is, are there any side effects or complications from having a gastroscopy? So what is it about?
Yes, the patient asked to the, yes, ma'am.
Okay, the patient is interested in just some effects after the procedure. Okay, so how much time do we have? Just about a minute. Now let us big and